joining us with this. And so let me say good morning, everybody. Welcome. I am Meg Disler. I'm the director of the St. Joe Community Health Foundation, and welcome to this first quarter webinar for the Prenatal and Infant Care Network. And based on a lot of feedback from different members on the steering committee, we think this topic is a really important topic, and hopefully you'll agree that you can learn a lot about this to be more effective for the people we have the privilege of serving when we talk about domestic violence. And what it means is a threat to pregnant women, their pregnancy, to infants in our homes. I'm going to ask for, in terms of housekeeping, we would like to invite everybody to please put your name in the chat box with your agency, and please feel free to add any kind of updates. And if we have some time at the end, we'll have room for any announcements that anybody wants to make, what's going on in their organization. But it's always nice to kind of see, when we see names and first names, who all's with us. So if you put your name and your organization, that would be great. Throughout the presentations, please feel free to add your questions to the chat box. Working with me here at the St. Joe Foundation, you'll see Angela Stanley, and Angela is going to be really monitoring that and helping to make sure we get all your questions answered with the different speakers. And also, if you have any technical issues throughout this, please reach out to Mark Burkholder, who is really the man behind the curtain, making all of this hopefully work smoothly for us, so it's a good presentation. And I appreciate everybody is filling up the chat box with your name and who all's with us today. So thank you for that. With that kind of opening, I do want to say that we've got a good program, so I want to get into it. We are going to start, though, with a quick pre-survey, so we have a sense of where everybody is. And it's, Mark, can you put it up? It's going to be interactive for everybody. And we ask you to please go through, fill it out, and so we can see how familiar they are with this topic just at the beginning of it. And while we're doing that, I'm not sure I said, this is the Prenatal and Infant Care Network. We appreciate, our purpose is to get together with all others in this community and Greater Allen County, Greater Fort Wayne, Northeast Indiana, to share our knowledge, our resources, so we can come together and do the best job and be aware of the best evidence-based practices and resources out there for all of the families of the community. So we thank you all for joining us and welcome any suggestions going forward of how we can strengthen your work or the work in the community for moms and babies. So have you ever identified a patient as needing help with domestic violence? So 74% of us have, and the rest of us are either no or unsure. So that's an opportunity there for growth. Do you feel you have the skills to assess a patient at risk for domestic violence? 62% said yes. So, and unsure. So hopefully we'll see at the end of this where we feel. And so do you want more training on? 97% said we want more training on motivational interviewing. We'll come back to that at the end, how much more, and if we need to, we have discussed the possibility of doing a special workshop or webinar just on that for everybody, because that was something the advisory group anticipated might be an opportunity for the community. So thank you for that feedback. So with that, I want to turn it over to our first speaker, is actually Erin Norton, and she's the Director of Community Outreach at Parkview Women's and Children's Services. She also is the coordinator of the Fetal Infant Mortality Review Task Force for this area. And it's just really a blessing for all of us who want to know the numbers, the data, the trends that are happening and what are we seeing when the worst cases come through? So, Erin, do you want to talk a little bit about why this topic you think is so important, or what you guys are seeing, and share that with us?
Yes, thank you very much for that nice introduction, Meg. I do coordinate the Allen County Fetal Infant Mortality Review. And for those who are unfamiliar, this is a group where we look at individual cases of when we have a fetal or infant death in the county. A review team gets together and we try to figure out what was going well for this family and where our opportunities are, how the care and support for this family could have been improved in hindsight. And we do this so we can figure out what's really affecting families here in our community. Sometimes they're similar to other communities and sometimes they're unique. I'm just making this really conversational today. I don't have any slides because the data gets a little tricky. I can't tell you, for example, that a certain percentage of the families that we're reviewing are experiencing domestic violence, because sometimes we don't have all of the documentation available to us. Sometimes there are some gaps in what we're able to really see and assess, but sometimes we have kind of some yellow flags or red flags that really make our team nervous. So I'm just gonna share some of the situations that we've seen, and we've seen enough of them that we really feel comfortable calling it a trend, that this isn't just kind of a one-off, fluke of a situation that's happening. Some of the situations we've seen, sometimes the domestic violence is not identified until the case review. And this could be perhaps 6 months after the baby's death, that it is in the interview process, where we go and interview mom, where it comes to light, where she maybe didn't feel comfortable sharing or telling anybody about the DV that was happening during her pregnancy until after the baby was born, and she was ready to leave or receive some help at that point. And we have also, in one situation that comes to mind, it was an immigrant mother. And so I'm really excited to hear what Melissa has to share today, specifically about immigrant families and how the documentation and culture can make an impact there. We've also seen many patients who, as we review their medical records, we don't find any documentation of screening. Now, this doesn't necessarily mean that no screening is happening, but without documentation, we don't know whether or not it's happened or not. So that really is a concern as well. And also gives us some opportunity as community members outside of the clinic or outside of the hospital. I think there's really some opportunity for all of us to have these conversations. And again, we've had multiple cases where the team has concerns that DV potentially is happening, where something just feels off and we can't quite put our finger on it, but it makes us uncomfortable. And we don't have enough data to kind of confirm or deny either way, but we're concerned. And again, in some of the cases where the DV isn't evident until we talk to mom after the pregnancy has ended, when we're doing the case review, and this is when it first comes to light. We know that those moms have typically been in a space where they are ready to make some change. They are thinking they've either left their situation or they're in the process of leaving, or they're ready for us to give them some resources to make a change. But we know that especially in some of the cases where we kind of have a bad feeling about it, those women will decline an interview, so we don't even have the opportunity to talk to them. So it's likely that if DV is occurring, that they're in kind of the pre-contemplative state of not really sure what they're wanting to do, or if they have a partner who is not allowing an interview to take place. Again, we can't say for certain whether or not these things are happening or not, but it is enough that it's really giving, we feel like it's happening enough that there's really a trend. And we want, as a community, to see a reduction in DV, first and foremost, because of the aside from pregnancy, aside from anything else, nobody deserves to be treated disrespectfully or harmed. And then we also know, particularly for this population, when we're in the business of preventing infant mortality, I can't even imagine the stress that this causes on a woman who is expecting a child. And we know that mental health and physical health are very closely related, and this can absolutely affect pregnancy outcomes. We know that physical violence can be detrimental to a woman carrying a child, and then also that sexual violence can result in pregnancy and can make for a really sad situation. So I'm looking forward to hearing the speakers talk today. It's a very important issue that is 100% affecting families here in Allen County. And I think that the more we learn and the more we know, we'll all be able to serve our community better. And I'm also very encouraged that 97% of us want more information on, was it trauma-informed care or motivational interviewing? I forget, I love both of them. But
motivational interviewing, but thank you, Erin. Perfect. I agree. So
thank you so much.
Well, one of the best part about working with the Prenatal and Infant Care Network is that there's some wonderful experts in this community that are a phone call away, an email away. And so with that, one of the first ones we have is Jennifer Rohlf. And Jennifer is the Director of Empowerment at the YWCA, Northeast Indiana. And Jennifer works, I'm going to just read the bio because I'll do that better this way, but Jennifer works to uphold the YMCA's mission of eliminating racism and empowering women through overseeing the Y's community education, domestic and sexual violence advocacy, and Dress for Success programming. She has served the YW since June 2013 and has previously held the position of Community Education Coordinator. She has been actively involved in providing a variety of educational trainings to the community on the topics of domestic violence, diversity, cyberbullying, and healthy, unhealthy relationships. She is a 2015 New Professional Journey Fellow and a 2016 award recipient of the Fort Wayne Business Weekly's 20 Millennials Making a Difference. Jennifer is a graduate from Purdue University with a Bachelor of Science in Public Health Promotion. And Jennifer, I have a lot to learn from you. So we're going to turn it over to you and Mark to enlighten us.
Well, thank you so much for that kind introduction. I appreciate it. Hi, everyone. I'm so glad that you all are joining the webinar today so that we can have some conversation and training around what domestic violence really looks like and how you can try to intervene when you have some suspicions that there might be some unhealthy dynamics in that situation. I am big on questions, so please don't hesitate to put some questions in the chat. Today, with the time we have, it'll definitely be, an overview. There's a lot more detail that we could go into. And so definitely feel free to ask those questions. And you're also welcome to reach out to me separately later if you want to go in more depth with maybe some situations that you have been seeing. And feel free, if you're able to pull up the slides. There we go. Okay, and you can go ahead and go to the next one. And so I'll be going over a brief overview of what domestic violence is, as well as some tips of some ways that in your different roles you might be able to interact and intervene, as well as a little overview of what the YWCA can provide. So first, talking about what domestic violence is, I like to always just break down the term domestic violence. Domestic, we're often thinking about people who either share a household or have some kind of intimate relationship. And then violence, I think the default is to think about physical violence, and that certainly can be part of it, but violence really is any kind of harm that is happening. And so as we're going to talk about in a second, there are lots of different types of violence that can occur, lots of different types of abuse. And so with domestic violence, it really is about power and control. That's why domestic violence happens. It's someone wanting to have that power and control over that other individual. And that could be a romantic partner, that could be a spouse, or that could be a previous partner where maybe they're not together anymore, but there can still be ongoing abuse happening within that relationship, especially if there are shared children involved, where there is maybe an ongoing reason for communication between those two individuals. And so with domestic violence, there's often a lot of stereotypes where we might be assuming that domestic violence is always men abusing women, that it only happens to certain people. It couldn't happen to me. It couldn't happen to someone I care about. The reality is that domestic violence can happen to anyone. Men certainly can be victims of abuse, and they also could be the abusers. Women certainly can be victims of abuse, or could be the abusers. It can certainly happen in different types of relationships. And the statistics show that about 1 in 3 to 1 in 4 women will experience domestic violence in their lifetime. And it's about 1 in 7 men. So I would guarantee we all know at least 3 women and at least 7 men. So we all have known someone that has experienced domestic violence, but we might not realize it. A lot of the time when domestic violence is occurring, that the person experiencing it might be keeping those things private. So you might not know, even though it's happening. So one thing I do like to point out, on the screen, you'll see some points about what domestic violence is and what it is not. And so one thing I always like to point out is alcohol and drugs. There is often comments I hear of, well, they only did it because they were high. They only did it because they were drunk. Of that abusive partner is only harming someone because they're under the influence. And I will say that that is definitely a myth, that while drugs and alcohol certainly can make the situation be more complicated, they are not the cause of domestic violence. Domestic violence comes back to that power and control. Drugs and alcohol do make the situation often more dangerous, but it is not the cause. And so the way I always describe that to people is I want you all to think about people that you know in your life. And can you think about someone you know that if they drink too much, they are really fun. They are the life of the party, everybody's best friend. And now I want you to think about if you know someone that if they drink too much, they get really angry and maybe they're not very fun to be around. And then lastly, I want you to think about if you know someone that if they drink too much, they are really emotional and maybe they cry a lot and there's a lot of feelings coming out. And so I imagine that we can all think about different people that respond in those different ways. And the reality is that alcohol does not cause behavior. People cause their behaviors. Alcohol and drugs do lower inhibitions and can make someone's guard go down, but it's still them. They're still responsible for the decisions that they are making. And so that can often be a hard point to talk to someone about, because they often want to believe that if this person gets sober, if they stop using, then maybe this won't happen anymore. But unfortunately, we do see that often that abuse is still present, even if the substance is not there. You can go ahead and go to the next slide. So then, as I mentioned, there are lots of different kinds of abuse that can occur. So on the screen, I have some different categories for you: physical, verbal, emotional, sexual, financial, legal, and religious. And so throughout the next few slides, I'll be going through some examples with you of different kinds of abuse. It certainly is not an exhaustive list, but it is hopefully going to help just give some examples of what that can look like. So first, in the next slide, you'll see physical abuse. That is the first thing people think about. They think about the punching, hitting, bruises, black eyes, and that is definitely a type of abuse, but as we're going to talk about, it's not the only way that it can happen. But even with physical abuse, as you look through things on the slide, it doesn't always involve physical contact. So I point out, like, blocks your exit or reckless driving. Physical abuse would be any kind of action that is putting someone's physical body in harm's way. So some examples, like I said, with the reckless driving, where I've seen situations where the person experiencing the abuse and the abusive partner may be in a vehicle together and they're arguing, and maybe the abuser, as they are arguing, starts to speed and run through red lights, and maybe even threatens, if that person doesn't do what they want them to do, that they're going to crash the car. And so I think we all can agree that as the passenger, your physical body is definitely in harm's way, but they're not touching you. So it can still be physical abuse, even if it's not involving physical contact. And with that can be so hard, because for the one experiencing it, one, how are they going to prove that ever happened? And two, it's not the traditional thing that people think about. And so as we'll keep going with domestic violence, you'll see that it can be a lot more complicated than what people might think of right off the bat. And so then the next one, verbal abuse. And so verbal abuse is more about using words to try to control that other person. That can involve put downs and name calling and lots of other examples. One I always like to point out is the joking, and you'll see there's quotations around it. And so sometimes it can be things like that they are saying hurtful things, but then when that person gets upset about it and maybe tells them to stop, they will downplay it. Oh, I was just joking. You're taking things too seriously. It's not a big deal. Only that abusive partner does mean what they are saying. They are trying to deflect that responsibility. And so with verbal abuse, this is definitely the type of abuse that happens most often, but it is the category that people are the quickest to dismiss, where it becomes normalized. Well, everyone fights sometimes, everyone says hurtful things sometimes, and that person starts to tell themselves that it's okay for their partner to talk to them like that. And what we hear from a lot of our clients is that the verbal and emotional abuse is often the kinds of abuse that has the most long-lasting effects, where those are the things that have kept them in that relationship, where they start to believe that maybe they deserve this treatment. The other thing with domestic violence is I definitely would say that things can happen on a spectrum, and it's very gradual. It's never that, on the first date, the other person says, hey, just so you know, I'm going to punch you tomorrow. Just a heads up. Like, you don't know this is coming. In the beginning, the relationship starts off as any relationship, and over time, little things start to happen. So maybe those little comments, the name calling, the things that we then dismiss and say, they didn't mean it. They just had a bad day. And then over time, things build up. You can go ahead and go to the next slide. So the verbal abuse is more about communication methods, whereas emotional is more about the behaviors. So you'll see a lot of the things on this slide are more action oriented. So just a couple of examples with the emotional abuse. The threats of getting custody of the children. So maybe things in the relationship have been escalating for a while, and then if there are shared children together, that abusive partner might make threats that, well, if you ever do leave me, I'm going to get custody and you're never going to see the kids again. And maybe that abusive partner is the one that makes most of the income. So they might state, I'm going to be able to hire an attorney and you won't. And so with the emotional abuse, there might be a variety of different actions and threats to try to gain that control over that person. Another big one, the isolation of trying to find different ways to push away that person's support system, where the abusive partner might be maybe convincing that person that their friends and family don't have their best interests in mind. That person's not really a good friend to you, or why can't you spend more time with me? And over time, kind of pushing out those support systems, where eventually all that person has left is their abusive partner. So then if someone does suggest you should leave that relationship, who would they go to? Who would they turn to when all they have at that moment is that abusive partner? Or even we see situations of maybe moving away from family and friends where their abusive partner has convinced them to move to a different city or a different state. And so now they don't have anybody around that they know, so they don't know where to start if they do need help. So just a couple of examples, and we can go to the next slide. And then this one doesn't have a ton of examples on it, but with sexual abuse, it could be any kind of sexual behavior that is forced, coerced, pressured in any way. And the big thing I see when it comes to our culture and domestic violence is, and sexual violence is thinking that sexual violence can't happen within a relationship. And it definitely can. But a lot of the time we see individuals who think that it's almost their duty to their partner to perform those sexual acts, to be sexually intimate with their dating partner or their spouse. And so when sexual assault is occurring within the relationship, they don't recognize it because there's that feeling of that I have to do this because I am dating that person or because we are in a relationship. And so try and have conversations with people we're working with about what consent really is, and what respect really looks like within a relationship is so important, because I can't count the amount of times that I talked with someone who has experienced sexual assault, but they don't see it that way because they have had consensual sex before with that person. So they assume that that means they have to continue, even if they are not wanting to any longer. And then we'll keep moving. I know we're going through these slides quickly. I promise we will slow down for the next sections. So financial and legal abuse. This is a category that people often say surprises them, but then once they hear it, it makes total sense. And so this could be using money or legal systems to gain control of the individual. And so sometimes this could be at the example I gave before of maybe threatening legal action against the other person, going to get custody of the kids, you're not going to see them again. It could be where where the abusive partner has most of the financial resources. So if you're trying to decide, do I stay in this relationship and continue to go through this abusive behavior, or do I leave and have nothing, where I will then have to, go to a shelter, be homeless, not have that roof over my head? That's a very difficult decision to make because they're trying to figure out how to get their basic needs met. And so throughout this slide, you'll see a variety of different examples of things that we see go on with financial and legal abuse. And it's often involving manipulating different systems to leave the other person with no resources. And another example I can think of, we had a client we were working with who was also in the human services, social work type of field, and her abusive partner, they had been divorced for a long time, but they did have children together, and he continued that abuse through the children ongoing. And he also would frequently make false DCS reports against the victim. And as I said, she was in the social work, human services field. And so this would often prevent her from being able to get employment, because he would make false DCS reports against her, which would then open up DCS cases. So then when she was applying for jobs and they were doing background checks, she would often not qualify because of the ongoing disputes with these false allegations. And the investigations would always show that there was no child abuse going on, but just causing those hurdles would then prevent her from getting employment again and again. And then the last one, religious abuse. So this is involving using religious teachings or beliefs to justify the abusive behavior. This is certainly not to say that religion is abusive. It is using that religious belief to try to manipulate the situation. And so I've seen this happen in many different ways. Like it could be quoting scriptures to try to justify the behavior. So for example, with Christianity, maybe quoting from the Bible, women submit to your husband, and using that to say, it is okay for me to do this because I am the husband, and so you have to do what I say. So it could be, you know, taking bits and pieces and saying that this means that it's okay for me to do this to you. And with this one, even if you know what that religious teaching says and really means, when you hear this again and again and again, it starts to change the way you view it. And we often see a lot of our clients start to doubt themselves of maybe I am the problem. Maybe I am being a bad spouse, and that's why this is happening. So it kind of is that combination with the emotional abuse of getting in that person's head. So that was a brief overview of some of the different types of abuse. And as I mentioned, with domestic violence, it really comes back to power and control, where the reason why they are doing these abusive behaviors is to gain power and control. And so the wheel that you were seeing on the screen, this is based off of the Duluth model, which is some research many years ago that was done on trying to understand domestic violence and what were some of those common pieces were. And time again, it became clear that it was rooted in power and control. And with this, as people, we all like to be in control of our life. We like to it feels good to have power, and it feels good to have control. But of course, that does not make it okay to harm other people to get that power, to get that control. So around the outside of the wheel, you'll see different examples of ways that somebody might, tactics that they might get that power and control. So some of it are the things I've already talked about: using isolation, using the children, emotional abuse. So using these different tactics to gain that power and control over time in that relationship. And one thing that I do like about the Duluth model is if you can just go to Google to search it, you can find different power and control wheels to fit different populations. So there are power and control wheels for immigrant communities, or for child abuse, or for individuals with disabilities. And it specializes that wheel to talk about some different factors that come up that are specific to that situation. And so that can be really helpful as you're trying to connect with someone that maybe you are concerned about, to touch on some of the things that might be specific to their situation. And one thing that I have done when talking with individuals that maybe aren't seeing that situation as domestic violence, I've given clients this wheel, printed it out and handed it to them, and asked them to shade in the sections of the wheel that describe their situation, or use a highlighter. And before you know it, you have a lot of yellow highlighter glaring back at you. And there's something about the visual of, it's one thing to talk about it, but to start to do some self-reflection and see, wow, a lot of this describes my situation, that can be really eye-opening. And so that's what we're going to talk about in a little bit, of just different tactics to try to help someone see that for themselves, of what is going on in their relationship and their situation. And you can go to the next slide. So I talked about that abuse, domestic violence is about power and control. And the other piece we often see is there is a cycle, a pattern of behavior that is playing out in that situation. So the cycle of violence is one way that we use to describe that pattern of behavior. And I know that all the things I've been talking about so far are depressing and they're not very fun to talk about. So I like to always use this as an opportunity to just change gears for a moment to think about something a little bit more positive. And so I'm going to ask everyone on the webinar to do a little bit of make believe with me. And so let's pretend for a moment that it is bright and sunny outside and it's warm, and we are going to go to Cedar Point and we're going to ride some roller coasters. So you're walking around at Cedar Point and you get in line for the Millennium Force. You're going to ride the roller coaster and you get in line, but you don't get to ride the roller coaster right away because we all have to wait. We're all social workers, so we're too poor for the fast pass, so we got to wait in the long line, right? So you're in line, you're waiting for that roller coaster, and as you're waiting, you get a little bit nervous. You're watching the roller coaster go by, and each time you hear how fast it's going and you get some butterflies in your stomach, you're feeling a little uneasy about it, but you tell yourself it's going to be fine. I'll be okay. And then you get closer and closer. Before you know it, it's your turn. So you sit down in that cart and the bar comes down and it clicks and you shake it. You make sure it's really secure. You buckle in tight. Okay, here we go. And you start to move, but you don't go fast right away. First, you go up that first big hill and you're slowly going up the hill and you hear it making that clicking sound, click, click. It's pulling the hill high and higher, almost to the top, and then it stops. It's holding you there. You're leaning backward. You're getting really nervous. You're above the trees. And before you know it, you fly down the hill. We're going really fast around the corners, up and down, and you're screaming and they take your picture and you look terrible, but you keep on going and then it stops. And it's all over with and you get off. And if you're me, you throw up and you say, I am never doing that ever again. But then a few minutes go by and your friends are telling you it's going to be fine. You know, you'll be okay. This one's not so bad. And you get back in line and you ride another roller coaster. And so I use that analogy to describe the cycle of violence. So with the cycle of violence, there are 3 phases. The first phase is tension building. So with the tension building on the roller coaster, that was the waiting in line, the anticipation leading up to it. In the relationship, tension building is when little things start to happen. So that is when, like any relationship, you start getting into some arguments, but things are maybe escalating and the arguments are becoming unhealthy. Or you're just getting an uneasy feeling. Like if I do or say the wrong thing, I'm going to set this person off and then things are going to get bad. During the tension building, it's leading up to it. And the next phase is the explosion. So on the roller coaster, the explosion was when you went down that big hill and you went throughout the ride. In the relationship, the explosion is when the abuse happens. So that could be when things get physically violent. It could be threats of harm. It could be threats to take the kids away. It could be any of the kinds of abuse that we were talking about before, but that's when things really escalate and things get really bad. And then the last phase is the calm phase, and that is the tricky one. So on the roller coaster, the calm phase is when you got off the ride, you had some time to kind of recover, and you decided to, go on another ride. In the relationship, the calm phase is when that abusive partner apologizes. They promise it'll never happen again. It was a one-time thing. I promise I can change. Lots of excuses are being made. Or even during the calm phase, it could be when things go back to how they used to be, where you're getting along really well. And it seems like they're trying to make things better. Maybe they even agree that they're going to go see a counselor and they're really going to try to make things better. And that calm phase can last a long time. But in domestic violence, what we see is eventually that tension building explosion will happen all over again, that it will keep repeating. So eventually the calm phase ends and go right back to that tension building explosion, calm phase all over again. And in abusive relationships, the more that this cycle happens, the harder it can be to leave. Because every time you go through that phase, that explosion phase breaks that person down. It breaks down their self-worth and their self-esteem. It makes them believe that you did something to cause this. And that calm phase gives them the hope that things are going to be better, that things will change. Maybe they've had a long history with that person. They have children together. They've been together for years. And so that hope that this relationship can work out and that things can get better, but eventually it keeps on repeating. And we see that in a situation of domestic violence where things are getting more dangerous, you see that the cycle tends to speed up, where that tension and that explosion happen more frequently, and the calm phase starts to get shorter and shorter. And if that is the case, that is definitely a red flag that the situation is getting more dangerous. And so the research has shown us that with domestic violence, the most dangerous time in domestic violence is when someone leaves. That when someone leaves an abusive relationship, that is when they are in the most risk of being murdered by their partner. And so I think it is very common when people hear about domestic violence to respond with, "Why don't you just leave? I would never put up with that. How could you let them treat you that way? Why don't you just leave?" And I think those kind of comments take away from realizing how dangerous leaving can be. Because once someone leaves an abusive relationship, that abusive partner has now lost control, and they get desperate to do whatever it takes to get control back. And so that really can put that person in a very dangerous spot. So with that, you can go to the next slide. I want to talk a little bit about how to help. So that's certainly not to say that it is a lost cause, that the domestic violence will just always have to happen. But it's important to understand that it is not as simple as just end the relationship. Because what we see is just because the relationship is over does not mean that the domestic violence stops. Many of the clients that we work with all the time are not with their partner anymore, but that partner is still continuing to find ways to abuse and threaten and control. So for all of you in your different roles, what are some ways that you can help with these situations? So the first piece is definitely training. Because if you don't have that basic knowledge of what domestic violence is, it's kind of hard to have any kind of intervention with how to help then, because we need to be able to identify it first and be able to talk about it in an educated way. And so with that training, like I said, today is really just a brief overview. There is, we can provide a lot more intensive training specific to different agencies, and that is a free service available to anyone within our service area, which is they're at Northeast Indiana. And so feel free to reach out later if you want to have more training for your staff to go into more details. But besides training, another way is as you are interacting with your patients, with your clients, whatever that interaction might be, trying to incorporate healthy and unhealthy relationship education, regardless of whether or not you think domestic violence is occurring. Because that is a conversation and a skill that is helpful no matter what. So having some just really simple education or activities where you can talk with people about what things are healthy or unhealthy in a relationship. So I have done things as simple as just making a T chart and put healthy on one side and unhealthy on the other, and then just have a conversation. Tell me about what are some things that to you are healthy in a relationship, and what are some things to you that are unhealthy in a relationship, and see what kinds of things that person says. Unfortunately, I have found that often when there's domestic violence going on, it might be easier to list off the unhealthy stuff because that stuff is happening all the time. But the healthy parts of the relationship are more foreign, where that is not maybe something that is regularly happening in that relationship. But just using simple activities to just start that conversation, because when you open that conversation up, then more things start to come about. I think if you just start off by asking, are you in an abusive relationship? You're probably not going to get a very honest answer from that. So just trying to start off with some basic, what's healthy, what's unhealthy, how do you communicate in a healthy way with someone, what's an unhealthy way to communicate, that can lead to some deeper conversations then coming. The next piece would be, especially if you have any suspicions that there is maybe something unhealthy happening in that relationship, finding discrete ways to offer deeper education and resources and hotline numbers and all those kinds of things. I have the YWCA's hotline on the screen. So our 24/7 hotline is 800-441-4073. That phone number is answered all the time. We have staff here 24/7. And so that's definitely a good phone number to provide people with, because they can call when it's a good time for them and get that help. But finding discrete ways. So obviously everyone's different services that they provide might be different, but if there's ways to talk to the individuals separately and have some reason that you would talk with, this adult by themselves versus with their partner. With our hotline cards, they're on small little business cards, so it's something that you can easily slip to somebody and it doesn't look very obvious. So finding discrete ways to get people resources and education, and sometimes you have to think up some kind of creative reason to do that. And then also making screening just part of your practice. So if you only wait to bring up the topic of domestic violence when you know it's happening, you're going to miss a lot of people, because they're going through it and they're not going to tell you because they're scared. They're scared that their partner is going to find out they told you, that you won't be able to help, that you're going to judge them. And so just trying to make it a more standard part of your practice to always bring up topics of healthy and unhealthy relationships and resources that are available if someone is in an unsafe situation. That way, even if they don't ever disclose to you, they are getting that help. And I know it's hard when you don't know what the end result's going to be, but a lot of the time when people do reach out to us, they will say, I heard about your services from so-and-so, my caseworker, my whoever it might be told me about you, and that's how I found out that you guys could help me. And so you never know where that could lead. And then the last one I have is just connecting with ongoing services. This training or any future training is not intended to make everyone on the call a domestic violence advocate that works, solely with survivors of domestic violence. But it's to give you that basic knowledge so that you can then connect with ongoing resources to take it from there. And one thing that can be really encouraging, if you have built a relationship with that client or that patient, whenever they, whatever you might call them, make that call together. It's one thing to give somebody a phone number, but to offer, do you want to call the YWCA together? I can sit here with you and we can make that phone call together, because it's really scary to take that first step. But if you can be that support system, they're much more likely to reach out and to, get that information. So then the next slide is just a little bit about what then the YWCA can do if you do connect someone with us. And once again, I love questions, so definitely feel free throughout this, if you do have some questions you've thought of, to put them in the chat. I'd be happy to answer those. So first, we do have our hotline that I've talked about a couple of times. We have our 24/7 hotline that is always answered. And then we do also have a shelter. So if someone needs a safe place to go and they are fleeing domestic or sexual violence, we do have a shelter for women, men, those with children, those without children, gender nonconforming, anyone at all who is fleeing a situation of domestic violence. And while someone's in shelter, we try to, of course, we provide that safe place for them to stay, but we also try to help connect them with resources and make sure that they can still do all the normal things they need to do in their life. So the children can still go to school, the parents can still go to work, all those kinds of things. But they do have a safe place to stay while they're trying to figure out next steps. And then we know that not everyone needs shelter. There are a lot of individuals who are experiencing domestic violence, but they have a place to stay, or maybe they're not sure what they want to do and they're just looking for some support. So that's where our advocates come in. So whether someone is living in the shelter or living somewhere in the community, we have advocates that can work one-on-one with people to provide them with safety planning, connection to resources, help navigating the legal system. So like getting protective orders, filing for custody, filing for divorce, all those kinds of things. And it's all free and completely confidential. And we cover a 6-county service area. So you'll see it on the screen: Allen, Wells, Huntington, Whitley, Noble, and DeKalb counties. And so with our clients, we will go to them. No one ever has to step foot in our building for them to get our help. We will try to make it as accessible as possible, because we know that it can be very difficult when they're navigating that relationship to be able to get away to talk to someone. So we will try to work with them to make that happen. And then on the screen, I do also have both a phone number as well as an email address that you can use to connect somebody with an advocate as well. So just to have multiple ways to connect somebody with us. And then lastly, we do also have mental health therapy. And so we know that if someone's experienced domestic and sexual violence, they've experienced trauma. And so we do have therapy services available to help people process that past trauma and work on healing and moving forward from that abusive situation. And so that is the really quick version of the domestic violence education, as well as the fast version of the YWCA services for those who experience domestic and sexual violence. So with that, I wanted to see if there are any questions about any of the things that I talked about that I could try to go into more detail or further explain.
We don't have any questions in the chat, but I was curious to follow up on, you said, not every individual person has to become, a social worker who's intervening and, getting involved, but how do you move people beyond not wanting to get involved and intervene on any level? Because sometimes you might know something's going on, but you're a little bit worried. Maybe you misread the situation. Maybe how do you get people to help?
Yeah. And so sometimes there are other caseworkers in the community who they just have a suspicion, but they're not really sure. And so there's been times where they have brought me or one of our other staff into a meeting with their client, where they're like, do you mind just coming along and just explaining what your services are? And, if they do end up needing them, at least then they'll know. And if it's not something that's relevant to their situation, well, then I guess they just got some more information, and that never hurts anybody either, right?
Yeah.
And so we're always willing to talk with someone, just to explain what it is that we offer and just see what happens from there. So that could always be a really simple way to go about it. But I really think if you want to try to get more information from that person to understand more of what might be happening, doing the relationship education is a great spot. And you can frame it in a way, because with everyone on the call, you're working with individuals who have children. And so once again, no matter what, it's helpful information. So to talk with them about what's healthy and unhealthy in a relationship is helpful for them and their relationship with their children, and to teach those skills. But also, if there is something unhealthy in that romantic relationship or intimate relationship they might be in, obviously that'll be a good way to start to bring some of that to the surface. And so I think, it doesn't always have to be explicitly, it is good if you have a suspicion to maybe be more explicit of asking, do you feel safe in your relationship? Is there something going on that you feel that you can't, talk to me as openly, or whatever it might be? You can certainly ask those more direct questions, but if that rapport is not there yet between you and that person, then maybe using some more indirect ways to start the conversation.
Thank you.
Yeah.
We have a question. What if a friend confides in you about being abused? What's the best way to help them? I'm not a provider or work in this capacity.
Yeah. So I think as far as for a friend of what is your role with that person, with domestic violence, you're never going to get anywhere telling somebody what they have to do. So saying, well, you need to do this because I said so. That is, if it was as simple as that, then they would have already ended the situation, right? So instead, trying to give people options and support so that they can make that decision for themselves. If you force someone to leave an abusive relationship when they're not emotionally ready for it, then they will go back because they're not ready. And so, so trying instead to give different options to work through the barriers. So if your friend has confided in you that things are not very good, but you know they want to stay with that person because of the kids, or they're not really sure how they would pay their rent without that person's income, trying to then look to, so what are options that could help with that problem? Because if we can try to take care of the barriers, then maybe they will be able to leave that situation. But also just offering that support. It's okay to be honest of, I'm worried about you. This doesn't sound like a safe situation. But making sure that comes with openness of, I want to be here for you, versus making someone feel judged or that they are stupid for staying. Because when that judgment comes across, and that definitely will make someone less likely to leave the situation. And also give your friend our contact information, or ask if they want to call us together so that they know there's other options. So those would be some of my suggestions.
In the chat, Jessica Ortiz made mention that regarding the power and control wheel, the equality wheel is also the counterpart to that, and it's a really good complementary tool. But she did ask, on average, how long do victims of domestic violence usually stay in shelters?
Yeah, so I want to ditto that of, yes, the equality wheel is great. I sometimes will give those side by side. So equality, like it sounds, is describing healthy relationships. So if you compare the healthy stuff versus the power and control, and they're seeing power control describes my relationship, that's a good red flag that this is not healthy. But with how long people stay in our shelter, we are an emergency shelter, which means that we are not intended to be someone's long-term housing. But we do try to have really individualized approaches with our clients, depending on what their barriers might be. I would say on average, people are in our shelter for like 1 to 2 months, but there is a lot of range in that. For some clients, they just need to come to shelter for a week until they can go move in with maybe a family member. And for other clients, maybe they have past evictions and they don't have income right now. So it's going to be a lot longer to help them get into their own stable housing. So in that case, they might be with us for quite a bit longer because of those barriers. But I would say an average is 1 to 2 months, but there's a lot of range in that.
I think that's all we have in the chat right now. Thank you.
Great.
Yeah,
Well, that's
absolutely. And I'll put my contact info in the chat if anyone wants to reach out later.
Thank you very much. I'm always learning, and I've certainly learned a lot now, and you've opened my head to a lot more thinking. And I know there's a lot more for me to learn. And Melissa Singh can, I think, share with us a little more in depth on this. Melissa is the Associate Family Justice Center Director for Amani Family Services. She attended Huntington University and has her bachelor's degree in history and political science. She is currently pursuing a Master of Social Work through IUPUI, with plans to continue to grow professionally in the areas of policy, advocacy, and program development as a macro social worker. In 2013, she traveled to Ethiopia And this experience led her to the human services profession and instilled a passion for working with immigrants and refugees. Today, she oversees all victim care programming at Amani Family Services. That includes advocacy and therapeutic services, as well as community education and outreach. She's also an active member of the Anti-Trafficking Network of Northeast Indiana, where she chairs the Victim Services Committee and is a member of the network steering committee. Melissa, please enlighten us further on this, particularly the cultural aspects.
Sure, let me share my screen here. Can everyone see this okay? All right, perfect. Yes, so thank you, Meg, for the introduction. Thank you to everyone for being here. As Meg shared, I am the Associate Family Justice Center Director at Amani Family Services, and I'm just really excited to share about domestic violence in immigrants and refugees. A lot of what Jennifer shared can directly be applied to what we see in this population as well. So there will be a little bit of an overview, but I'll definitely be sharing information that is just trends that we're seeing in this area. A lot of it is general information of what we're seeing. Each case though is very unique. So again, I'll be going over general information and trends, but every case that comes to our office is just unique in what they're experiencing and how we address those cases as well. So to get started, I know Jennifer did a great run through of what domestic violence is. And just to share what examples are within this that we're seeing within the communities here in Fort Wayne, with the physical abuse, sexual abuse, emotional abuse, is with physical abuse, again, it's that piece where it may be hitting, punching, cutting. Within the immigrant refugee community, I know our office has seen an increase in firearms within domestic violence situations, as well as cases now being tried for attempted murder. So we are seeing an increase in escalated violence within this area of domestic violence. But any type of physical abuse, we always take very, very seriously. And we see a wide variety of pieces within that. Sexual abuse, as Jennifer shared as well, in a lot of relationships within the families that we work with, they feel that they have to engage in sexual acts. If their partner wants that, they have to do that. And even if they do not want to, they will still engage in that feeling that they have to. That could be for cultural reasons of what may be taught to individuals, what a relationship would look like or a marriage would look like. But that is one area that, especially when we start working with families, we don't hear about that as much. But once you build that relationship and individuals share more of their experience, the sexual abuse piece comes up often. And a lot of our work at Amani is educating individuals on their rights, that you do not have to engage in a sexual act if that's something that you do not consent to, no matter what that relationship is. So that is something very, very common within the immigrant and refugee community here in Fort Wayne. Again, it's, as Jennifer shared, it's that feeling that they have to engage in that because that is their partner, whether that's by marriage or they're dating or whatever that may be, that feeling that they have to. Emotional abuse, that deflating self-esteem, self-worth, that's so common in a lot of the cases that we hear and work with, where individuals are told that they'll never succeed at something, or they're not good enough, or oh, they don't want to hang out with you. Why would you try to go out and be friends with them? And so individuals continue to isolate themselves, to feel like they don't have community. The only one they have is really their abuser that they can go to. And really just that feeling of self-worth and that confidence just continues to deflate, that people feel like they don't really have options. Looking at the economic abuse, we often see within our families, it may be a stay-at-home mom who's with the children all day, and maybe the father or their partner will go out, they go to work, and they keep all of the funds. They don't give any money to the client. There's that control within that piece, that they really have no financial means. And we hear often with the families that come in that, you know, they haven't had a job here in the US. They don't really know what that looks like. They don't have any money. And so what do I do then? Where do I go? I don't have any money for rent to take care of my children, because for so long that has been kept from them. We also see with many of our families as well, where maybe the partner stays at home and our clients, they are going out and working. They have a full-time job, but the expectation is that they are to give all of their money to their partner to control the finances. Even though they're the ones going out and working, they will not have any access to their money. So economic abuse is a big piece. And the last one is the psychological abuse, that intimidation, threatening. We see a lot of cyber stalking. Facebook, social media is often used to send messages, to post. A lot of the families we work with live in a very collectivist culture. And so that has such an influence in what we do. And I'll explain a little bit more of that later. But really posting to the community about the victim has a huge impact, and social media is often used with that. Also threats, immigration comes up often. Even if someone has maybe a green card or status, that is still used as a threat for that individual of, oh, if you say something, you'll get deported. Or it could be, if you say something, I will get deported as the abuser. You don't want me to leave. That, why would you want me to leave? Why would you want that to happen to me? So immigration plays such a significant role in why individuals come forward or why they do not come forward as well. Again, Jennifer did a great job explaining the wheel of power and control. This is something we often use in our office. I would encourage all of you to really use this within your work. We take this to our visits with our clients. It's just a great way to have a visual of what examples are in these areas, because oftentimes you hear about physical violence, sexual violence, but especially that emotional violence, some of these other pieces that aren't as visible. Our clients don't really know how to describe that to other people, or is that domestic violence? And that's always a question that we get. So this is a great tool, but just to kind of go over real quick with this is that domestic violence is all about power and control, and that it really goes beyond that physical abuse, that it's not that someone has to physically harm you for it to be domestic violence. But again, it's that power and control. And so to go into, I put causes and excuses here. These are, a lot of times the victims that we work with, or even the abusers, say, oh, this is what caused me to do this, or he only does this when he drinks, or, there are causes and excuses. But with domestic violence, there's always that choice. That abuser is always making that choice to act how they're acting. And so just that little caveat there. But with causes and excuses, these are specific things that we hear within the immigrant and refugee community in Fort Wayne. Again, these are just very general things that we hear. There's a lot of different pieces within this. But the first one is we hear a lot about financial pressures. Oftentimes in our office, especially with our Burmese advocate who is working with people of Burma in the community, a lot of our clients describe gambling houses. You may have heard about these within your work and with clients, but we often hear of, with the victims of domestic violence, that their spouse or partner goes to these gambling houses. That's what we hear, and they're playing cards, they're drinking, there may be drug use, and they come home and domestic violence takes place. And so a lot of the families, again, we hear this often within the Burmese community that we work with, where they bring this up of, oh, if they just didn't go there, then I wouldn't have this experience. But this is a common trend that we are seeing in our office and the community with gambling and these social gatherings. Drug and alcohol abuse, as well as generational abuse. Within some cultures, there's that kind of that dominant man runs the house, and there's these ideas of what that looks like. And maybe, and this is common with families here that were born and raised in the United States. So it's not always just within immigrant refugee communities, but that generational abuse that, I saw this happen with my parents. This is what I know. And then this is continuing in my relationship. So it occurs over time, as well as down here, I have culturally accepted behaviors that this is what it is. Again, there's that generational piece, and that typical acceptance of male behavior. We often hear individuals not always understand or really don't know what their rights are here in the United States within relationships or within their individual rights. And so again, just seeing, what is culturally accepted in the community that can take place, and oh, that's just how men are. And I say that, that's just how men are. But there are also individuals we work with who are men who are victims as well. But a vast majority are female victims. So also cultural differences within marriage. We have a variety of cases that it could be, and this is for myself as well. My husband is immigrated from India. I was born and raised here. We have a lot of cultural differences between the two of us. And so there's just different things of, I use myself as an example there of, we see things very differently. We grew up very differently. And so some of the families we work with, it may be that they are coming from two very different cultures, whether people of Burma is such a diverse ethnic culture, and maybe you see that there, or it could be someone immigrating to the US to be with a US born spouse. And so there can be conflict that comes within that as well. And we hear that as, again, a cause and excuse of, bringing domestic violence and that stress that takes place there. The other piece that is super common is from women experiencing freedom, as well as just women's rights within the United States. Within the US, there's that piece of, women going to work, pursue an education, that strong woman figure. And for many of our clients, where they came from, that's very common maybe to be a stay-at-home mother, to not go out and find employment, to maybe not pursue higher education. And so now being in the US, a lot of our families want to experience that. They want to pursue that. And that can also lead to a lot of conflict within the household. Just resettling in the US, I worked in refugee resettlement for a number of years. It's an incredibly stressful process. It's very exciting for families to be in the United States, that conflict and all of the pieces within refugee camps, to be away from that and to have stability within the home. But there's also those pieces of adjusting to new cultures within the United States, and what that means and what people want to pursue within families. Again, that can lead to that conflict. Specific concerns for immigrants and refugees. Also, like you probably could have guessed this, the language barrier piece comes up quite a bit. That could be a variety of ways. One could be that the parents maybe do not speak English, but the children are speaking English. And you may see out in the community, we see it often where children are being used as interpreters for their parents. And that can lead to very interesting family dynamics and that shift in power within the family as well. But within domestic violence cases too, we see often children being used as interpreters, maybe with the police or with other entities. And so it's, you have a 10-year-old that's interpreting about a domestic violence case to the police, and again, other individuals in the community, that conflict and that trauma for that child as well, with explaining that situation, and for the victim to feel like they're not able to share their story. I'm relying on my child to share this for me. And so there's that dynamic there, as well as with the language barrier side. Not every victim, and I'll get into again later of specific concerns that we've heard from our clients, but they do not always access services because they're unsure if they call somewhere, will someone speak my language? Will they have someone that is in person that I can talk to versus I call, and then we have to try to find an interpreter, and then that whole process and over the phone interpretation is very different than in person. And we get that feedback a lot from our clients. So there's that language barrier that may lead to someone not reaching out for help or for services. The other piece are new laws or systems. The American criminal justice system is super complicated. I've been a part of this for years, and I don't feel like I fully understand all of it still. There's just so many pieces to it. And for many in the immigrant refugee community, our system looks entirely different from the system they may have had in their home country. And so to even try to apply what they knew, the system looked like to here, it may not even overlap. And so just that not fully knowing the laws in the US or how processes work really inhibits victims from moving forward with cases. The other unique piece we see are faith marriages versus legal marriages. You may work with someone that they may say, oh, my husband, this and this. And when you start really working on the case for domestic violence to go to court and move forward, you find out that, oh, that was a faith marriage, not a legal marriage. And what I mean by that is a faith marriage may be that they go to like a mosque, a church, whatever that may be within their community, and the religious figure declares that they're married. But that marriage certificate is not given then to the court system here to make that a legal marriage. So we'll have clients who are wanting to pursue divorce in a domestic violence case, or to look at child custody, or all these different areas. And we really start to dig into it and look at moving forward. We find out that there wasn't really technically a legal marriage within the United States. And that can complicate some things, as well as how we move forward, maybe what they move forward with when they separate, what they have access to financially, housing wise, all of these other pieces. So that's a huge unique need, that area that we see within this community. And really on the advocacy side, it helps, just we have to know that to know how to guide the case. But that is a piece that you may hear when you're working with families. I've had families identify, oh, I'm in a faith marriage. Oh, this is legal marriage. And that's really what they're referring to. Again, I brought up previously the culture, family dynamics, expected gender roles. There's these expectations maybe within cultures of, what one is to do within the family. And if someone is not wanting to do that again, there's that conflict that can come there, but also culture, the family dynamics and gender roles can be a place that normalizes domestic violence as well. And immigration status. Undocumented individuals may feel that they have no options if they're in a domestic violence situation. And there are many options. You can pursue different types of visas, immigration status if domestic violence takes place, as well as you can still get a protective order. You can still get these different pieces that help with your safety and for you to feel secure. But immigration status, it's often used, again, within families that we work with, whether that's the victim is scared to do anything because their abuser is telling them they'll get deported, or the abuser will say, well, if you come forward, then I'll be deported, and how could I ever help you, or do you not love me then? So immigration, the status is used quite a bit. Some indicators. So if you're out in the community, you're going on a home visit, you're meeting with someone, some different things to look at or to look for when you're with families are physical injuries. I've been on visits where I would notice bruises on someone's face that weren't there previously. And to ask questions of, hey, like what happened? And you may have someone that actually says what happened, and 9 times out of 10 I would usually hear, oh, I fell, or it's something unrelated. But at least it gets the conversation going, and it shows that you're also looking for those things. So physical injuries, if someone mentions any type of threat that they don't feel safe, maybe they're talking about someone intimidating them, even just someone giving like text messages, or again, that social media piece. Current police involvement. We have some cases we work on that I know the police are called out about every other week, going to the home. And so that's just something I know on our end that's super important for us to know, that again, the police are currently involved. They're looking into this case, that we know even if the victim isn't ready to leave, but there is that severity within the domestic violence, as well as individuals feeling sad, depressed. They're describing that low self-esteem, maybe difficulty concentrating. If you're going on visits and you feel like the conversation isn't flowing, they're not really engaged in that conversation, that can be an indicator as well. Denied money, resources, very isolated, problems with sleep. And that isolation from friends and family, our families that we work with, again, it's that many are from a collectivist culture. And so when you're working with immigrants and refugees and they're describing, not really being a part of the community, being isolated, that's a huge indicator of domestic violence, that separation. And just words from Amani clients. So at this time, Amani is aligning with what we call the Family Justice Center model. And we're really looking to bring on-site partners to Amani's office, with Amani being a safe place that our clients know. I know for myself, like if I'm going to court or these other places, it's intimidating to go to all of these places, to even know where to go. And so at this time, our office, we're really looking at bringing legal services, the police, the prosecutor's office on a part-time basis to Amani, so our clients can go somewhere they know and somewhere they feel safe to speak with different criminal justice entities. So that's just that's very brief. I could talk about that all day, but through our process of really moving into that model, we conducted focus groups with individuals in the community. Mainly it was in people of Burma, as well as with our Hispanic community. And there were top barriers that individuals who have experienced domestic violence indicated to us. And these are reasons why they had not accessed services, or really just like difficulties they had when they tried to access. And the first barrier, and this everyone gave this one, was transportation was huge. A lot of our clients, they do not have driver's license, or they're very unsure of how to access public transportation, or because of economic abuse, they do not have funding, and they cannot pay someone to take them. They cannot pay for a bus pass. And so transportation has come up as a huge barrier for a lot of survivors of domestic violence. That fear of deportation was number two. All of the clients brought that up. Even if they had status, just not fully knowing, and immigration is so complicated, but not fully knowing how all of that works. And still, even with status, they feared that because that's what their abuser led them to believe. The other piece was unsure how to navigate systems. They had no idea, again, how systems may have worked in Thailand are completely different here in the US. And so not even knowing where to start. And then the last bit that we heard from our clients was that their first contact outside of their abusive relationship did not always know resources. And so it may have been they were isolated, or they would talk to a family member or a friend. And when they finally disclosed the domestic violence, it wasn't a service provider, but it was someone within the community, and that person was unsure of where to go. So those are just, again, barriers that our clients, individuals in the community have outlined that they're experiencing. And I know at Amani, having learned this, really, how can we tailor our services with community education and resources to really help navigate this? And the last bit is how to connect for help. Amani, we have 2 advocates and a therapist and myself. We are the victim care team. And so we work directly with immigrants and refugees who are victims of crime, whether we're going to court, protective orders, really anything to really support victims. And if you're working with anyone in the community that is an immigrant or refugee that needs additional resources, you feel free to go to our website, AmaniFamilyServices.org, click for Connect for Help. And this little picture on the bottom is what our referral sheet looks like, and you can fill that out. That is instantly given to our prevention coordinator, and we will have an advocate on the phone with the client within 24 hours. We move very quickly on these cases to make sure that when individuals are ready to receive services, that they're able to connect to someone right away. That's also my contact information. If you have any additional questions or just want to chat about this topic or anything, feel free to call or email me. More than happy to chat. And this is just personally an area I'm extremely passionate about. I love what Amani's been doing in this area. The Y has been, with Jennifer, has been such a great partner in serving survivors of domestic violence. So that is my bit. I guess any questions?
We don't have any questions in the chat right now, but while you're thinking of them, we do have a survey that we can do. And while we do that, you guys can think of questions to pop into the chat and we can ask those as well. And Melissa, we do have a question for you from Jennifer. Could you talk about how you help survivors navigate the immigration processes?
Yes, so currently we have a partnership with Neighborhood Christian Legal Clinic, and we provide an on-site legal clinic. So if anyone has any questions about their personal immigration status or options that they have, we will bring them to Amani with an interpreter and their advocate to really talk through that process. We also have through Facebook Live and different other trainings, we will choose a general topic, whether that's U visas, asylum processes, a variety of immigration processes that are there. With Neighborhood Christian Legal Clinic, we will provide that information online within multiple languages as well. So that's on Amani's Facebook page. If anyone has any questions on that, they can view that information.
So we have another question in the chat for Jennifer and Melissa. Do you encourage community groups to watch The Maid or read the book for discussion who may want to help but not have a reference point?
So surprisingly, I have personally not watched The Maid. I think I experience this so much in my day-to-day that I tend to gear away from watching this in my personal time. But I really think, I don't know specifically on this. What I've read and heard about it, it sounds like it does portray domestic violence possibly accurately. So I think anything when it comes to books, and again, maybe Jennifer, if you've seen it, may have an opinion on that, but something that others have really endorsed that does portray it well. I think that's a great tool to have to really understand fully what domestic violence looks like, what that story is. Again, to understand that. But again, I haven't watched The Maid to actually, I guess, give an endorsement.
Same. I've also been told by everyone to watch it, but I also try to balance. I do also get a lot of that in my 9 to 5. So, but I would say I think when you see someone's story, it can help it all make a lot more sense. So I think it can be a great way to understand the situation better. I think it's always just trigger warning of knowing that if you've been through some of those things personally, that might be hard to watch. So just, use balance with yourself. I know that it might be hard for you to hear about that if you've also personally experienced things.
Thank you.
Well, I notice it's 1 o'clock, and so I want to make sure to be respectful of everyone's time. Thank you, Erin. Thank you, Jennifer. Thank you, Melissa. Thank you, Angela and Mark, for helping put together just a really informative session today. We have recorded this. We will have it up on our website along with their PowerPoints, so you can easily reference any of the material. If you have any suggestions on other topics you want the prenatal and infant care or PIC network to address, be sure to let us know. We're always interested in listening and learning. But with that, I'm going to thank everyone and tell you to have a great afternoon.